Happy Wednesday, everybody. I'm Lauren Swagger. I think I know most of you now. It's good to see you on this day. I'm going to screen share and we're going to talk about school services today. And Kathleen is probably far more an expert in some of this than me. And so I welcome everyone to kind of chime in and make this as interactive as possible. My focus today is how we can kind of bridge mental health and psychiatry and communicate with schools is the ultimate goal. And so I'm going to share with you some legislation that impacts a lot of the paperwork and decision making at the school level, but also kind of hopefully add some practical information so we can help our patients and our cases. And I know all my PBS people have lots of interactions with the school. So please, if you have some great ideas, shout them out. So as everyone knows, I like to be interrupted. So let me find the screen share button. Can you guys see that okay?
Yes.
Okay. All right. Well, I'm at the bottom, that's why. Okay. Okay. So today we're going to talk about some of the legislation and some of the terminology. One of the things that I will say is a lot of educating yourself about alphabet soup with working with the school system, and I had to sit through a lot of IEP meetings and school services to even begin to sort of decode all of this. We're talking like 3-letter acronyms sometimes, so understanding what the acronym means is really important. So we're going to talk about that too. But if I use an acronym and you don't know what it means, please also interrupt me, because that means probably everybody else on this does not know it either. I am not a school teacher. I do not have direct knowledge of these systems. I've only participated in them as a clinician, and so I'm trying to offer my perspective on that from the mental health end and working with schools. I was a school consultation liaison person for about 10 years with Mon County Public School, and we used to go see kids in the school system and make recommendations on how to be helpful directly in the classroom. But I've sort of since transitioned to sort of more trying to communicate about mental health and behavioral needs of kids from the perspective of their care. Now I'm back to the schools. But what I will say is what I have learned from that process is I have a very, very deep respect for school teachers, special education teachers, and really trying to do the right thing. And what I have found, despite all the frustration that occurs in communications and HIPAA and FERPA and all those terms I'm going to define for you, really at the end of the day, most all my experiences with school have been extraordinarily positive. I found it a really helpful place to really support kids' mental health. And the biggest advice I would have is pick up the phone and call and talk to each other. I've never had a teacher not want to talk to me, and I've always found that really helpful. And so on the backstory of all our paperwork and terminology, this is really about extending, for me, the care of kids into their natural environment, which is school. So some fun facts: 95% of all kids go to school, and so it is an easy place to reach people. It's also a place where mental health issues do emerge, and 1 in 5 of young people who actually need mental health services are actually getting them in the community or from a psychiatrist or mental health specialist. And lots of times these things are showing up in the school in more naturalistic environments without a diagnosis, or the school may be the first line of support for getting kids the help they need. Some of the terminology and terms sort of root back in some legislation, and one of the things that I end up doing a lot with this legislation is doing a lot of psychoeducation with parents about what all these terms mean. I, having the experience of being overwhelmed by all the acronyms, certainly appreciate that lots of times this goes right over parents' heads in these meetings. And so sometimes just kind of slowing it down and walking through with parents what all these terms mean is also kind of what we do. So a lot of the legislation regarding special education goes back to some foundational principles. One is in the 14th Amendment. So going way back to the Constitution is that we have equal protection, and prohibiting discrimination is where a lot of the roots of this lie. And then also the 1954 case of Brown versus the Board of Education was, this was sort of getting rid of the separate but equal doctrine, is that all of these rights must be available on equal terms to all students, including students with disabilities or mental health. This came down to 3 key pieces of legislation, which we'll talk about. But not only does it need to be equal and equivalent and inclusive, but this other term is really important to understand, is that it has to be in the least restrictive environment. That means that attempts at being inclusive in the general education as much as we can be is their goal. Sometimes I actually have parents that want more special education services and get upset or talk about services being reduced, which is I think the wrong language. But the real goal is to sort of prove that those services can't be provided in the general environment if you're going to step it down. So the burden for the education system is to do their best to be inclusive to begin with and step it back, as opposed to the reverse. And sometimes that's something parents don't understand. It doesn't mean that the services change. It's just where they occur needs to sometimes happen. And sometimes that's actually hard. Some parents struggle with that concept. They feel their kid needs more restrictions or more one-to-one or more support, and really not sort of understanding why being as inclusive as possible is also helpful for those other needs of childhood. And so really understanding that and helping people realize that's not a negative thing sometimes is the land that I live in. And so some of the terms that come out of this are Section 504 of the Rehabilitation Act of 1973. And so we're going to use the term 504 plan a lot, which is one of the school services we're going to talk about. And that term 504 plan comes specifically from this law. We're going to talk about the IDEA Act, which is Individuals with Disabilities Specific to Education. The American Disabilities Act that came out in 1990 is actually not specific to education. This is actually the one that actually extends into the workplace as well, but it does apply to young people. All right, so we're going to start off by the 504 plan. So this is one of the official services that schools can kind of offer and put into place for a student. Again, the language is about equal access. So the term that really comes out in understanding a 504 plan is accommodations and modifications. So a 504 plan does not specifically change the environment or the educational level that's being delivered. So you're a 4th grade student, you will still do 4th grade level work, but the 504 plan means that there are accommodations and services to help support you in doing that. So for example, perhaps you get to sit at the front of the room for your accommodation so you can see the board better. Or you might need to sit next to the teacher so that if you have a question, you can ask it privately. Or if you have a medical condition like diabetes, that you know you can go to the nurse's office to get your blood sugar checked, even if it's in the middle of the test, if you feel sick, so that it doesn't disrupt your health. So it's not actually changing the tests, it's not changing the materials, it's really just changing and supporting you in your ability to be able to do your best with the educational service. So when you write a 504 plan, you're talking about what accommodations and services can we make to support you in a normal education level, so to speak. And we're going to give some examples about that, but that is a very specific difference. Okay. when we talk about sort of disability, and some of this terminology applies to an IEP or an individualized education plan, which we're going to talk about next, is knowing what the terminology kind of means. And sometimes when I'm writing notes or talking to schools about trying to really support the need, I sometimes use some of these languages to support the reason I'm making that. So generally, a disability is defined as any physical or mental impairment that limits a major life activity or activity of daily living, or there's a record of impairment, or this child has an impairment. It's kind of easy for a doctor to say that because I give diagnosis and I say they have this disorder, but technically there's less need for physician documentation with the 504. So if there's general acceptance of these things, they can still make those recommendations. And again, the 504 plan is just accommodations to eliminate barriers to participate and engage in school, so that they have the same access and opportunities for success as their non-disabled peers. Okay, so this isn't making school easier. This is leveling the playing field with services. So this is the official diagnosis of a physical mental impairment. Really, any medical or psychiatric disorder easily fits into all these categories. So you see how complex it is, covering sort of all areas of medicine. This is sort of the language regarding major activities. And so some of the things that are in there, which I think are important, is, again, this is very inclusive. So it includes things like self-care. It includes things like your ability to walk, see, speak, think, sleep, communicate, social skills. All of those things are considered major life activities. So these are very broad definitions, and the key with giving even a psychiatric or medical disability is you have to show evidence of limitation. So when we're giving someone a diagnosis, even a psychiatric diagnosis, it really has to have they have exhibited dysfunction beyond what is expected developmentally and for the general population to get that diagnosis in the first place. So this just goes through the details of those terms. Okay, and this was also a really important thing that came out, is that these are not about whether the student is doing well or not academically. It's really important to recognize that just because someone has straight A's and they're being successful academically, it does not mean that they have a disability. And we cannot assume that doing well doing well academically is not the same thing. And I think that's really important for mental health, because so many of what my patients with mental health illnesses often have are what I call the invisible illnesses. While ADHD might be an example of a more obvious one if someone's very hyper, things like just having attention problems, depression, anxiety can almost be sort of silent illnesses that people might not readily recognize that really are affecting their abilities. And we certainly want to give that support before it gets to a point of impacting their academics. So it's really important that we don't base people's grades on that part specifically. So a 504 plan is pretty flexible. There's not as much rules about how 504 plans write. So the teams at the school, and these are school-based teams that meet, really just have to be kind of broad about people knowledgeable about who needs to be present. So it can include the student, it can include some data, it can include counselors, parents, whoever knows about the plan. And a 504 plan often has a written format, but there's no standard about what that format could be. In fact, there's not as many rules. And when we talk about the IEPs, where there are lots of rules, the 504 plan can feel very small. So 504 plans are really just people that care about the student getting together to sort of discuss and ultimately discuss what the implementation may be to be supportive. And it could be one thing, or it can be a lot of different things. And they really have a conversation. And this is usually a very helpful conversation where they talk about and ask what would be helpful, and they try to put it in writing so that this information gets disseminated to the people that need it to be supportive of the student, but isn't rigid enough that getting the meeting in the first place or writing the paperwork becomes the barrier. So 504s can be quite flexible. So anybody want to guess what the #1 reason that kids with mental health, maybe from a child psychiatrist, might suggest the student needs a 504 plan? What do you want to guess what the most common diagnosis might be for me to write a 504 plan?
Maybe ADHD.
Correct. Because ADHD is a chronic condition, right? It does not impact our intelligence. We should be able to do the work on grade level with ADHD. It's not specific, but it's a chronic medical illness that impacts major life activities, right? Focus, concentration, ability to maybe impact things, but it also is going to need some services. And I would say for the most part, schools are super good at this, and often it just needs verification of the diagnosis and the school runs with it. But often kids do need some supports to be successful, because medication is not going to be the end all of perfect success with your executive functioning. It can be helpful, and some kids with medicine or improvement may not need the accommodations, but these are examples of some things that can be really helpful to those students, again, to show their best and have a chance for success. Again, not changing the schoolwork, but certainly can make it kind of more manageable to them. So that can include things like extra time on assignments and tests, so that they have like a chance to go back and double check things or kind of work through, reduce volume of assignments, taking information, complex information, breaking it down into smaller chunks that don't require as much attention, giving things in shorter assignments, helped with organizational strategies. Like sometimes they also give kids like an extra class in organization or support. It can include outlines, texts, preferential seating at the front of the room. Sometimes they'll let schools take tests in quiet environments, and not everybody needs these things. And in fact, most of these things help all students, but this is often becomes a conversation with the family and the student about where are we struggling and what kind of things can we offer. Honestly, what I will say is that I have a lot of students that are so anxious on top of their accommodations that just by virtue of knowing they're helped. And sometimes they don't even need the accommodations, or they choose not to after a certain time, but sometimes just having access so they don't feel worried about it. In fact, probably 9 times out of 10, telling them they have extra time, they still don't need it. It just kind of reduces the anxiety so that they feel like they're not climbing that wall. But these are all things that schools often build into those plans. Okay, now we're moving into the more complex sort of law and where things get much more complicated on paper. So the IDEA Act was a federal law from 1975 that's had several updates again, that really sort of moved into the category of what qualifies for special education. So special education is defined as different from general education. So when special education occurs, and again, this is a bit reductionistic, but you are changing the curriculum in some ways from kind of what the normative curriculum is. So an example of this is a student that has gifted services, where they're even operating at a level above grade level, receives an IEP because they are getting services not at grade level, okay? If you have a student that has a significant learning disability and they're performing below grade level to the point that their normal curriculum needs shifted, so they're on a more developmentally appropriate service in a specialized room or needs extra support, they also might have an IEP for a learning disability. So there's some true change in the curriculum. This is not specifically just accommodations. They are making changes in the environment on a chronic basis to help the student. If the student cannot see and needs all their text converted to Braille, that's a permanent need that changes their curriculum and needs new textbooks and things like that that support their needs. So when you're getting into changing the standard curriculum, we're talking about IEPs. And these are the categories of which one can receive an IEP. And on the IEP paperwork, and those of you who have seen IEPs, they can be a mountain of paperwork and very specific. They're often very complete. You have to mark under what category is this child receiving their IEP services. So some of those services include a serious emotional disturbance, which most psychiatric illnesses will fall under, and I'll give you a better definition of that here in a minute. A learning difference that sort of is considered a learning disorder, where you're usually significantly below several standard deviations of where you are at grade level. An intellectual disability, a cognitive level change, a traumatic brain injury, autism, chronic vision and hearing impairments, physical disabilities, developmental delays that can include things like speech or language problems, or other health impairments, which is a very generic big category as well, which we will also define. So the definition of emotional disorder is the following. And this is one of those things when I'm often talking to sort of schools and trying to support their level of documentation need, I will often try to use this language to be helpful. So this is again very broad, but also somewhat specific. So one or more of the following characteristics that is exhibited to a marked degree over an extended period of time that affects the child's educational performance. So it's an inability to learn that cannot be explained by intellectual, sensory, or health factors. An inability to build or maintain satisfactory interpersonal relationships, so getting at that social needs. Inappropriate types of behaviors or feelings under normal circumstances, so this can be disruptive behaviors. Pervasive mood or unhappiness or depression, or a tendency to develop physical symptoms or fears associated with personal or school problems, which we often call sort of psychosomatic or functional illness, where the presentation becomes physical but may have an emotional cause. And so just about anything in my textbook of diagnoses that I see could probably fall under this category. And so sometimes when I'm explaining to someone a psychiatric disorder that they might not be familiar with, I need to use this terminology. And I'll give you an example, although it's a rare example. And I have a student with a thought disorder, schizophrenia, which is not something that most people fully understand. I often have to explain how schizophrenia or a thought disorder might affect these different aspects and justify their performance. The other big sort of broad category that a lot of things fall under is other health impairment, which is meant to be a really grab all category, but this is an acute or chronic health problem that results in limited alertness with respect to educational environment. And so this is the one that ADHD can fall under if trying to justify the IEP, because the inability to attend and focus might limit their alertness. But this is where other sort of physical illnesses sometimes lie, or chronic health conditions can sometimes lie. Things like narcolepsy, sleep disorders that impact wakefulness could all perhaps fit under this category. And again, when you're advocating that there's a chronic condition and trying to help the school justify the IEP, if a kid's falling asleep in class because they have narcolepsy, perhaps getting narcolepsy included under other health impairment as a chronic factor of alertness affecting their learning is a way you can kind of approach that to see if that level of need is there. Okay, so doctors do not decide about school services, and that's something that has to be remembered completely. I do not make decisions about that. The healthcare system is separate from the educational system. So the school has to decide and create these services. And families need to sort of understand the role that we and they may play. the law sort of says that everybody is responsible for looking for needs and services. It doesn't task any one individual to look for the services. So often I have a conversation with the family that I will certainly support them in their communication, but it's not my place to assess how I don't know how to assess someone's educational ability, but I can help them understand the mental health issues so they can have an open sort of door to begin a discussion. And I really want them to have a discussion with the school, because actually what I will say is that sometimes school systems have far more resources, and different school systems have different things that are sometimes so helpful that you want that to be a conversation, because I have seen schools bend over backwards with grief resources and library resources and a whole array of different things to help a student that I didn't even know they had. And so this is really, from my perspective, a way to really open up the conversation, communicate, document for the school what they might need to justify the service. So often when I'm trying to sort of communicate, I just want to provide medical information for the school that they can use, but meet with the family. So I kind of think it is sometimes families are afraid to go to the school directly. And so what I often find is my process of writing this with the family together, they then use my little note to go to the school and say, hey, my doctor thought maybe we could have a conversation and talk about this. And the school's like, oh yeah. And then they feel really helped, but they're almost kind of like afraid, or they don't know sometimes who to reach out. So I am very like, let's give this information to school and get you scheduled with them to talk about options as a way to get the conversation started. So this is actually some of the stuff I write. I usually write, so-and-so is a patient of mine I've been seeing since this. They have been officially diagnosed with this. They continue to report to me that it is impacting their school in the following ways. And I give examples like, I'm falling asleep during class, I feel really behind, I can't focus, whatever the symptom may be. And then I usually say, I've urged the family to reach out to you to see if there are additional school services support that might be helpful. And sometimes students are really like specific about what they might need. We can talk about some examples, but I have students that have pseudo seizures or conversion disorder symptoms that will have like seizure-like episodes in school that are not medical. But they're like terrified of having that pseudo seizure. And if we don't tell the school, if you have a pseudo seizure at school and they can't tell it's a real seizure, they call an ambulance and send you to the hospital. And that student really doesn't want that to happen, because that's embarrassing, and they want to know what to do or how the schools can react. So we might talk about options, and I might make suggestions. Sometimes there are concerns I have regarding learning issues or cognition levels, and I do not have access to that testing. And insurance does not pay for IQ testing or learning testing. So sometimes parents, instead of going to the school, are going to the doctors to ask for those things. And so I will sometimes, especially if I'm talking to a student and they do seem to have like a cognition that seems lower, like it looks like an IQ or a learning thing. And I gotta tell you, I'm not good at assessing learning disabilities. I have no idea how to assess learning disabilities. You need the test. And so I sometimes just write a little note, please consider psychoeducational testing. And I'll just sort of summarize what the parent said, or I can say, I'm concerned about some cognitive delays based on my exam. Could you consider? And I always write, could you consider? I'll do that for two reasons. One, again, it is not up to me to make that decision. We'll talk about how that process works. Sometimes the testing's already been done. The parent agreed to it and it's been done and they don't even know it. And so I have written some of those notes and the teacher's been like, we already did it, here's a copy. I was like, oh yeah, good. And I will like sit down with the parent and go over it because they just didn't understand it. And so I tell the parents that sometimes, even though they had to sign permission for it, they forget or they don't know what it is. And then sometimes I will say, I don't have to do this a whole lot anymore. But when I started here, before there was so much information in the school about trauma, I was getting lots of kids with really disruptive behaviors that were really coming from trauma, other true causes, and it was really not understood. And I was having kids get expelled and kicked out for what they were labeling as legal problems and behaviors, and it really was secondary to other issues. And so I often sometimes would be concerned, like I had a kid who punched somebody regularly or disrupted math class, or no, it wasn't math, it was reading class because they couldn't read. And I finally said, you know, what's going on with reading? Like you, or English class, you're always like getting in trouble in English class. And the kid told me he couldn't read, and he was so embarrassed that it was easier to get sent to the principal's office and get sent home than acknowledge that. And it was really quite honest. They're not usually that honest, but sometimes that behavior was a way to escape or sort of not cope. And so I had to write a lot of explaining about that. I think special education teachers often really get that already. Sometimes general education doesn't get that, or they don't have that understanding. And so sometimes I'll be kind of talking more about what areas I do know with the mental health, and talk about how it could look at school and kind of engaging that. And as I said, I often call the school directly, but sometimes it really is helpful to kind of give that parent more of a, help them kind of feel confident in reaching out. So how does an IEP actually happen? Again, requests from evaluations or concerns can really come from anyone. It could be the general education teacher, it could be a doctor, it could be the parent themselves. And sometimes I ask the parents to write it. I do think it is helpful to put it in writing, only because everything about IEPs ends up having to be in writing, and it's important to sort of start that process. So usually somebody identifies a need, and if there's a need or a concern and that's submitted in writing, they begin a process where they consider an evaluation. Okay, and that period of evaluation is they're trying to determine if it meets the level of need for an IEP to begin with versus something else. So during that evaluation period, they'll have lots of things be looked at. That may be kind of an investigation period where they're looking for past testing, or the school might decide to do the testing themselves, or they might be trying to get records from doctors or medical history or verification of medicines, vision or hearing screens, speech screens, occupational screens, additional questionnaires. And they have this, it's a collection of information period where lots of different people might assess the student, and the parent has to approve that those assessments can happen. As all that process concludes, they have something called an eligibility meeting. And this is that overwhelming meeting to parents that they don't always understand what it is, but it brings all the people, the parent, the student, if they want and are old enough, and all the people that evaluated the student, or representatives from the people that evaluated the student. And there are very strict rules about who has to be there. They have to have so many people from administration, so many people from special ed, so many people from general ed to represent the students. And they meet and they say, we have looked at all of this. We either feel they meet criteria or they don't. And if they meet criteria, they have to put together this giant document of services to put in place. And then once that plan is put in place, it's reviewed at least every year. And then they may have to reevaluate every 3 years. That process from the time of evaluation to eligibility is not fast, because all this has to be collected and there's no exact timeline on when it needs to be. I would say, depending on how backed up things may be or how busy, I would say that time frame seems to average around 90 working days. So it's not a fast process. The other thing about the IEP, although you can call an emergency IEP meeting at any point, IEPs are much better for chronic fixed needs than they are for evolving needs. We have to frequently meet often, because if you have to bring in all of these different people and you have to have all these different numbers to have an IEP meeting, that level of restriction could not be helpful for acute or evolving problems. And so sometimes IEPs may not be as helpful, or the bar may not be met for the IEP, but might be more appropriate for a 504 plan or a SAT team, which we'll talk about here in a minute. So these are sort of the legal requirements about who has to participate, and they have to fill this out. They have to sign their name. They have to show that all these people were present. The parent has to either waive their right to be there. And so the ability to get like all these people in the room at the same time is really, really a challenge. And so as I said, this is a very, very formal process. And I think sometimes not understanding the difference between what the IEP can do versus some of the other things could be quite helpful. But all of these folks have to be represented. So what if you aren't one of the school personnel? Like, what can I do as a therapist, a doctor, a counselor? And this is where I really like advocate, let's be helpful. So if you like for PBS, if you know, you guys work with schools all the time, you know, sometimes we can come to meetings and provide advice, but we are always doing so at the guest of the parents. We are not school employees. We have to be invited. And I just try to be helpful. I know that schools complain all the time that they can't get my records and they want my records, and there's so many protections on getting records that like, do you need my records or do you just need a letter and a diagnosis? What do you need? Because some parents do not want their medical records where I talk about the complex fights going on at home or trauma. Like, does the school need to know that? And the parents may not release that. So there's all these burdens. So I just say be helpful, and I will often write separate letters or notes, or as I said, get a verbal release and call. But this process for them of collecting all this information is really supposed to help the student, and trying to not be a barrier and be helpful are the things that I like to do. And so if there are already evaluations done, past testing done, trying to get those to the school, but making sure you have permission to do so from the parents are very important. Parents can be very different in what they want. Some parents are 100% tell them whatever you need, we want help. Some parents are very afraid to share information with the school, and sometimes think that schools are like CPS and they're worried about all sorts of things regarding their own health. And so there's a lot of nuance there and how we do that. But trying to be helpful and communicate what you need and build trust, I think is really, really helpful. After that IEP is created, this is where the massive document comes in. They summarize everything that can have the current levels of their testing. This is a 4th grader, but they're at 3rd grade in math or kindergarten level in reading. They'll talk about all those evaluations, and they'll begin setting goals and objectives with measurable benchmarks and a step-by-step plan of, you know, by the end of the year, this child will move up this much and obtain these scores. It will list modifications and accommodations that might be present. Those are still part of an IEP. They will list a time frame, what % of time is in general education, what % of time is in special education. It will talk about other services the kid may be receiving. Are they getting occupational therapy? Are they getting speech therapy? As they get older and they've been in special ed for a long time, they might chart about transition services when they graduate or they transition to another school. Or the transition that might happen to adulthood, and schools in high school help students with vocational rehab, or things like Title 19 services could be part of that. And it can include a lot of different things. For behaviors, it can include things like a functional behavioral analysis or behavioral intervention plan that can be written and built. There's a lot of things that can happen, even if they need a special transportation, like a special bus or lift devices. Those things all get written into this giant document. And so just to kind of review, and as I said, a lot of times I just sit down and I talk about this process with the parents because they don't understand the difference. So again, you identify a concern, you submit a written request. This evaluation process goes through to assess the needs fully. And then there's that eligibility meeting. And the language says in a reasonable time frame, but I tell people it's usually sometimes feels like up to a whole semester to a 9-week period to move from that evaluation process. And then at that time that evaluation is complete, you will have this eligibility meeting with get all the people in the room to really talk about if this kid needs IEPs. Now, the answer may be they need an IEP or they don't, but they can still recommend other services if the IEP is not met. So they can still use this information to help build a 504 or a SAT team meeting if that seems to be more appropriate. And this meeting sort of repeats itself once a year, if in fact that it happens. And it can also sort of talk about the level of care, and I'm not going to go into that, but there are alternative school placements that things fall under. There can be specialized schools, there can be alternative learning schools. That could be a decision for some families. And again, it's reviewed annually. A couple things I think are worth noting. This is again often where I have gotten pulled in different ways. And I think there's been a big shift, at least in West Virginia, about how this is handled, and I'm very, very proud of that. When I came here, 13 years ago, about every kid I ended up seeing had been kicked out of school, like they had been expelled because of behaviors. With again, I don't know why. I mean, things had been out of control for a long time, but often a lot of those kids had not had appropriate assessments or understanding of their behaviors. And so these are things I had to deal with a lot more. I think we see this less, but when disruptive behaviors at school are really the complaint, I really kind of go back to what some of my folks in PBS do all the time is really like, let's go back and really understand this behavior. And I often will sometimes write, let's get the psychologist on board to do a functional behavioral analysis so I can get more data about what this is, also in rating scales, and get information from the school. And then if they really are showing like key targets about what's driving the behaviors, we can really come up with a behavioral intervention plan that can be written and put in place to help the student have success. And so those terms often really get started. I find a lot of times that nobody knew to ask the school psychologist to do those things, or that was not something even initially schools would reach out. I think sometimes this happens much more. And so now lots of times I come seeing the functional behavioral assessment or the behavioral intervention plan and whether it's working or not. So we've really made a lot of progress. Other things to kind of be aware of: this is not, having a disability is not an excuse to do bad things. And there are still bad things that you can do that aren't related to disabilities and get you big trouble. And those things are having weapons on school grounds and having drugs are going to get you in trouble big time. And you can't usually justify your disability as the reason you did those things. But one of the things that is important, especially regarding aggression or disruptive behaviors, is there is this term called a manifest determination review. And when a student has gotten lots of suspensions of 10 days or more, they have to sit and discuss, is this child's behavior coming from their disability or not? If it's not coming from their disability, they can be expelled. If it is, it really justifies that they need to go back and revisit the IEP. And so I've gotten pulled into these because oftentimes, to be honest, some of the behavior really does seem to be from their disability. This is maybe uncontrolled ADHD, this is uncontrolled PTSD, and it's contributing to what's going on. And again, it doesn't excuse bad behavior, but it sometimes says, does this child need another level of care? Or do we need to think of other things to keep them safe? But I really think that people are using this more appropriately. I certainly have seen less kids expelled from school. That was like my daily job when I started, and it was really sad because then you had a kid who was struggling but not able to get an education, and there became two problems. So I just wanted to comment on that, although I haven't directly had much of that lately. And then again, here's just a review of some of the acronyms. We talked about behavioral intervention. Positive behavioral support gets utilized in the school a lot. Functional behavioral analysis, extended school year if a child needs to go to school in summer, or talented and gifted are all terminology that might come out of that. And again, this is the American Disabilities Act that really just sort of says that if you go to a federally funded school, you have to provide these services, 504 plans and IEPs. This does not count if you go to private school. And I actually have a lot of parents that sometimes choose private school because they have lower ratios with thinking of services, and they don't. And the school's under no obligation to offer them. And so that can be kind of a complex sort of conversation. And, you know, and the school may say, we don't feel like we can help you. We don't have an autism teacher. And they really aren't required to do so. And so I really, you know, I think people are always trying to do what's best in their minds for their kids, but sometimes pulling the kid out of school when there are federally protected ways to educate them, or only certain schools have certain programs, is really not always the best choice. And it's really important to help people know what their rights are. And then the other part is the Americans with Disabilities Act is the same laws that extend to the workplace. And then from going from high school to college is the American Disabilities Act that continues. IEPs, 504s do not impact college educations, but the American Disabilities Acts do. And so there is some overlap. Now, West Virginia has some specific language. I'm going to really focus on the student assistant team because that's a very state term, and a lot of our students have student assistant teams instead of IEPs and 504s. They also use individualized healthcare plans and multi-tiered systems of support, which are state terminology. And in the state grid, it kind of looks like this, where the student assistant team is maybe the lowest level support, and then it can kind of go up to IEP based on what they need. So student assistant team is in the West Virginia Code. It is, again, designed to be flexible, but the part about the student assistant teams is they can really meet frequently and be far more flexible in terms of meeting often and adapting quickly for students that have had persistent concerns. And so they meet very fast, usually within 10 days of the time to meet. And they will quickly kind of problem solve and be able to sort of get maybe interventions in faster. They certainly can then go forth and sort of recommend the 504 or an individual education plan if indicated. But the SAT team has a lot more flexibility, and you don't need a diagnosis. You don't need all that paperwork. You can problem solve right away. And so I find I have kids when they step down from hospitals after they've been admitted for a psychiatric reason, like suicidality, or there was an event at school like bullying. Often student assistant teams are really fast ways to kind of connect and get processes started for families. You do not need both a 504 plan, an IEP, and a SAT. You should not have all three. So you will kind of enter at one point in the process. And just again, from my perspective, there may be lots of reasons. I sort of suggest, now I tend to, when a condition becomes more chronic and not as immediate, I do tend to suggest the 504 plan, especially with illnesses that can remit and relapse. And so these may be some reasons I consider a 504. I tend to shift more to the SAT, or suggest the SAT, or explain the SAT when it's more of an acute issue, like grief or loss or something that might resolve over time. But these are the reasons I often might suggest it. And I've even written, again, I know it seems strange in our world, but I've had kids whose parents died. I had a child whose mom committed suicide, and they didn't want to tell the school. And part of it was, let's tell the school. And that school did an amazing job. They had the library spend extra time with the kid reading books on grief. They can do a lot of different things. And so sometimes I think it's just selling it to the family or understanding it. But these may be things I write for. Again, often I think a lot of school services are really good with anxiety and depression and ADHD, but I think it is very overwhelming to schools when kids have physical symptoms. And so my amount of information I get or have to talk with someone varies depending on how complex it is. And I will say that talking to schools about how to deal with people that have seizures that are non-electrical and pass out because they create so much fear in response and how sending them to the hospital is not the right answer and they really are okay. And you don't have to, and helping them still work through, because then these kids get sent home and then they're missing out on education and it becomes a problem. Those are the hardest ones. But again, lots of success in building that if you can get accommodations. And kids are always worried about missing school. And I have parents all the time saying they can't miss school, they can't miss school. Look, I don't want your kid to miss school either, but I also don't want your kid being depressed and not learning their best either. Or I don't want you missing your diabetes appointments to check your blood sugar because you're afraid to miss school. And so there really are ways to build and communicate how best to do that, and make sure that your rights are protected. And I have never, ever had the actual school say, no, we don't want them to come to their mental health appointments. They're like, yes, please go to your mental health appointments. What do you want? How can we accommodate that? And again, a lot of it is about communication, but the parents are very worried and they're like, well, if I take them to the doctor, you're going to call me in for truancy. Nope. Actually, you get called in for truancy when you don't communicate that you're taking the kid to the doctor. So let's really work on that part. And I just wanted to add a little quip about bullying. Bullying is a big issue, and again, a big shift in how schools have approached bullying. Lots of kids have severe emotional consequences of their bullying, and kids with disabilities are much more likely to get bullied. And so lots of times, these are taken directly from the West Virginia Department of Education website, as they really have talked about this language. When a school knows of bullying that is occurring based on a student's disability, it has to take immediate and appropriate action to investigate and see what's going on. And they will also do great things. There are always examples of parents saying things didn't go well, but most of the time the school doesn't even know it's happening, and we have to build in support so that we can, and there's simple things that you can do to help bullying. I have said, let's have the kids switch classes when the students aren't in the hall. They can leave 1 minute early, get to their next class. They don't have to deal with that kid. Let's change the class. Let's move the seat. There's lots of easy things that can be done. But these are always complex stories because he said, she said sort of things, and perceptions can be really intense, but there really are lots of protocols to deal with that, and it's to the interest of all to deal with that. So if you know a student has an IEP of 504 is SAT, my number one advice is get a copy. Much like schools have problems getting records from us, I have trouble getting records from school, and it's because of FERPA, which is the Educational Protections for Educational Rights and Privacy, and then HIPAA is the Medical Rights for Privacy. And so I've been most successful with having the family just bring me a copy. And oftentimes I have had parents tell me the school does nothing, they have no services, and then I'll see an IEP where they have more services than I've ever seen before in my life, and they don't even know it. And so lots of times all the information I need is in there. I can do a lot of ADHD evaluations. I get a copy of the IEP and it has every ADHD criteria for 6 years already in the chart, and I don't have to then repeat or redo the task. So there's a lot of information in there for you as a clinician, but it's also a real opportunity to explain what the school's already doing to be helpful. And sometimes, especially with home, I found that some of the things that the school's doing is really successful, and we can translate it to things at home that also work for the parents, so that we're consistent in all settings. So just really good information in there. You don't want to reinvent the wheel, but it's also an opportunity to sit down knowing that child as an individual and also explaining it to the parents, because I even find my son has an IEP, and it is still an incredibly overwhelming thing. I've looked at hundreds of IEPs, but it's just mind-blowing all the information that's in there. And so it's not easy for most people to dissect or know how to interpret it for what it means for their child. And so communicate, get a release, call the person if you can, and be aware of lots of the resources. And I've put some websites here. This is the American Academy of Child and Adolescent Psychiatry that talks all about school services with regards to mental health. There's actually practice parameters for mental health clinicians on how to interact with the schools. And then the Department of Education has copies of the IEPs, like sample copies you can see online. They have parent portals that ask all these questions and lots of paperwork. Same thing with the US Department of Education. Again, these are complex policies and really hard to read and hard for most people to understand, but there's lots of really good information out there. None of this is meant to be secretive, but sometimes it requires, I think, an interpreter. So that is all I have for you today with 3 minutes left. Does anyone have any questions or stories? I guess I know you all have worked with schools a lot. Are there any stories that you've had? As I said, 99% of all my encounters with school have ultimately been incredibly positive, and probably 93% have been whatever stress was there. It was communication issues between families and people, and it just got so much better when we talked about it. So I'm curious what your all's experiences have been.
All right, thank you so much. That was excellent. And yes, I'm not going to take up much time, so I just want anybody to chime in. You can chat in, or you can raise your hand, or just unmute yourself and speak up, please.
Dr. Swager, I just wanted to say I've spent about 20 years in schools as a behavioral health person, and I have never even heard an educator share this information as well as you did. And so really to, make that connection between, the mental health and the education system, just an outstanding job. Excellent.
Thank you.
Thank you so much. That was very, very nice, kind words and truthful words. You did a great job and should be talked about more. I really respect teachers and those in school situations. My sister's a teacher, and I'm very proud of her because they do a lot. Does anybody else have any questions? I see that you unmuted.
I have noticed here, nurse practitioner, pediatrics, I have noted recently that we're having a little bit of an increase in the unwillingness to go to school. Yeah, so kids kind of got out of the pattern with COVID and everything, and we always had a little bit of an issue with it, but kind of got out of the pattern and are having some truancy issues. It's how do you address that, especially if it's a kid who has some behavior issues? I think teachers are more likely to, I think what I've noticed is it's okay, don't bring them, don't send them. And then the parents like, well, the teacher said that, they didn't have to come. And then I can't get a hold of the teacher. I can't discuss the patient with without permission. So it's hard for me to know. And we also have difficulty getting a hold of that IEP from the Board of Education a lot. So it's difficult to know what to do in that case. Sometimes I see these patients 2 or 3 times a week.
Right.
School notes because.
Well, so yeah, we're seeing that too. I think my answer is really try to understand what the cause of not wanting to go to school is. As I said, I think people hear truancy and they go to always being unwilling or unable, I guess. And I think the answer is the reasons kids don't go to school is really complex and diverse. And I also will say that the pandemic changed some of my thinking about schools and kids, and has really made me kind of rethink some of the approaches. So I really try to understand exactly what's going on with the school. I tell the parents if they don't sign that release to talk to the school and begin to problem solve strategies, they're going to get in trouble for truancy, and we need to communicate to stop that process now. You can always be proactive. If you react after the absences without any notice, you're going to be in far bigger trouble. And so really kind of talk about options, because lots of times the schools already have solutions. We don't even know about what solutions they have if we reach out and communicate first. So reasons kids aren't going to school. There are kids that are super socially anxious or avoidant or terrified of COVID, and they're not going to school for legitimate anxiety and health reasons. If that's the case, we want to make sure that the underlying condition is being treated. So it could be things like, yes, you need to come to your appointment 3 times a week because you're really struggling that much that we need to problem solve, and we need the school to understand that. or it's an understanding, or if the kid is too sick and too ill to go to school consistently, does that imply something like partial homebound, where there can be a bridging plan with an individualized teacher, and homebound is temporary with a plan to reintegrate back? And that can be things like, okay, I'm going to give you 6 weeks of this intensive stuff, and then we're going to go to 1 period a day, or we're going to go to 2 periods a day, but you build this with the school. There's other things that I've learned during COVID, and I'm going to be really frank. I was really against homebound for anxious kids. I really thought that that did them a lot of disservices if I just avoided it. And it is the avoidance that's the problem. But I saw kids thrive with virtual options. And although we talked about so many kids that didn't succeed, there were some kids that made straight A's for the first time in their life without the
Yeah,
social
and
pressures
I'm
of school.
similar.
And so my answer to that is, and as long as the child's getting their social needs met in other environments, which they often do, they have small groups and things that they can do. I actually write a letter supporting them in doing the virtual education options. Our state did not have virtual education options for years, which was way behind other states. And some kids really do well with that. And so I've had to write requests to have kids join the virtual option later in the year because they missed the window, or suggesting that that option be homebound until they can join the virtual option. Again, the goal is to be successful in your mental health and in academics, and sometimes we need to get creative in how that does. And again, sometimes schools still have virtual options that I don't even know about. And so it really is a communication of what that, some kids I literally just have are avoiding. And they are not doing well avoiding. They're not going to school from their anxiety, but they're also failing. And they did not do the virtual options. And those kids may need to go back to school with 504 plans where, hey, you go back to school and you sit in the counselor's office for the first hour of the day as a prearranged arrangement with the school so that you feel safe, or you know that you can go to the counselor, you have this pass. We write this pass, you just show the teacher, you go to the counselor's office when you're overwhelmed or need to talk. And this is all stuff you build with the school, not like telling them what to do. But the first step is finding who that contact person is at the school. Schools will bend over backwards to get people there. They just get real pissed off if they don't know, and they're not going to be helpful if they don't know, and they're going to think that they're intentionally avoiding. And those are the people that end up with the truancy and the problems. And so as I said, I just try to be really proactive. I will call with the parent in the room. Sometimes I will pick up the phone and I said, this is so-and-so. Is there anyone at the school that can talk to, or the counselor's office could talk to me right now? And I swear, like, the teachers will, I think, interrupt class sometimes to get off the phone to talk. And we just have that. And as I said, but it's so helpful to make that connection. And the parents want to hear it, and they can hear it in that moment. And so I think that little note I write that says there's legit stuff going on also kind of gives them that, like, it's like a golden ticket that I can go have this meeting with the school, and they do, and they come back saying, well, that was really helpful. The school put in place all of these things, and I feel so much better, and the parent feels so much better. And so I think what I would have to tell you is, I don't think there's any magic one size fits all answer to that. Every single kid has needed something different, but we figured it out by starting the conversation, and I have been more flexible in my understanding about what works. But I also tell families everything has to work, right? It can't just be that the school part works. It can't just be that the mental health part works. And if you're avoiding to feel better, but your school's failing, still something's not working. So we got to approach this like a multi-pronged kind of event. And I think they kind of get it. As I said, I said, well, somebody's gonna get bad, they can get mad at me. And I sort of own that part too. But the lack of communication is really what gets people in trouble. And I tell them straight out, if you aren't talking to the school about why you're missing, I'm not gonna be able to help you. We have to start that conversation. We have to start that conversation now.
Okay.
And as I said, most of the time they're afraid to. And I think that just sort of that hand holding sort of seems to help. But yeah, I'm not as anti-homebound as I think I was before. But I also am very clear with parents that homebound is not a magic solution. And if you're homebound doing school, you still got to meet your social needs, and still got to get out there and do some other things. And so sometimes it's been creative, like you go part of the day. or you go
There's a little
to
bit of
the
a
tech
challenge
center at night, right?
Yeah, there's a little bit of a challenge here because I think the schools are short-staffed.
Right.
So yeah, so like, you know, kind of meeting the needs of everyone that's homebound, they're kind of struggling a little bit as well. So that's kind of played a little part as well, you know.
Well, and I think sometimes shortening the day, like, okay, let's go every other day, or let's go half a day, can be really helpful, too. And again, we're like, well, you're gonna miss out. Okay, so you're gonna focus on 4 classes this semester. You won't get the credits for the other stuff, but we'll work on that later, you know. And that's where they can think about summer school or credit recovery. As I said, if you don't address it now, you're just gonna get behind. And I think, again, it's like those accommodations. Sometimes just knowing that the option is there, people feel better. And I've had lots of kids like try the half day. They're like, you know, after a week, this wasn't so bad, and they want to go back the whole day. And it can, I mean, as I said, but it's just kind of getting it in the door. And again, as I said, this is not a conversation I have unilaterally, and I would say different school districts give me different answers. Some schools will talk about how, oh, we have homebound at the tech center, they can go to night school every Thursday and do this and this and this. And another school will be like, you know, our system is set up with more homebound teachers right now. That might be the best way to, and so again, I sort of problem solve from the buffet of all the choices and pick the least bad choice sometimes, but that's okay. As I said, I think the communication matters, and I find that the avoidance, you know, I think if you avoid the school, they won. If you're not there, how can they be helpful to you? And it's hard to, when you're not there, it's hard to be helpful. And so they're going to direct their attention to other students, and it's going to feel more adversarial than it is too. But I don't know. I just haven't had. They've all been so positive. Like I don't want to be like, overly like glowy rainbows and unicorns, but I've heard horrible things from when the parents come in my room, and it's never been as bad as they think it's going to be. And we've ended up having good solutions, like 99.9. I can't even think of a bad one. The only bad ones have been when they refuse to do anything. And even like talking about like homeschooling, right, where kids like remove their kids from the curriculum is a really important discussion. Like, can you as a parent really do this? It's hard being a teacher and a parent. Like, how are you going to do both? Is your kid really self-paced? You know, you still have to register. Do you still know there's rules about that? And kind of talking about that, sort of just helping them problem solve so you're not making reactive decisions. And then I end up with some kids that had been removed from public school, never registered, have been off the radar and not been in school for really long periods of time. And they are way behind. And how do you get them reintegrated? And so, as I said, I don't have any great answers, but as I said, I have not been disappointed in my reach outs, if that helps.
Great, thank you. Thank you so much. So we just had one chat in interest of time. I'm just gonna discuss that really quick, launch the poll, and let you know about our next announcement. Said I've noticed one of my kids is starting to have more and more pandemic anxiety about being in school, especially after one of his classmates got it. And I think that's relatable even on an adult sense. I'm not eager to, I love being around people, but I'm not eager to go back to work. Like, I don't want to be around a possibility of that happening.